Hello and welcome to another episode of Persivia Perspective. I am your host, Nidah Shahid, and today we are going to be diving into one of the most talked topics and perhaps the most misunderstood one in modern healthcare, which is artificial intelligence. Joining me again is Dr. Usama Bajwa, Persivia's engineer manager for AI, to help us unpack a big question. Is AI truly the future of healthcare, or are we just chasing hype? We'll be framing this conversation around three mindsets that we're seeing in the industry. Number one is FOMO, that is the fear of missing out, healthcare organizations rushing to implement AI just to keep up. Or is it JOMO, the joy of missing out, those taking a more cautious and evidence driven approach, and FOGO, the fear of getting overwhelmed, leaders who are hesitant to dive in due to the complexity, regulation, or past fatigue. Whether you are an AI skeptic, a conscious optimistic, or already deep into deployment, we've got insights that you don't want to miss out. So, Dr. Sama, welcome back. And to start off, what do you think? Is AI in healthcare a trend or a transformation? And which one dominates the three mindsets? FOMO, JOMO, or FOCO?
Thank you, Nida. AI in healthcare is more than just a trend. It's a transformative force. But the way it's being approached right now feels more like a roller coaster. But we see massive excitement, often without any roadmap, and that puts most of us in the FOMO zone. Organizations are worried about being left behind. So that fear is real and often drives early adoption before the value is even clear. At the same time, JOMO is gaining ground as some leaders are taking a more pragmatic approach, which frankly might pay off better in the long run. And finally, FOGO is the silent blocker, as organizations are paralyzed by complexity, uncertainty, or lack of resources. But if I had to pick one dominant mindset today, it's FOMO, the fear of missing the AI train is driving more decisions than we could actually like to admit.
So, Dr. Osama, then why do the organizations feel this need to implement AI? What is this? Why do they feel pressure to do so?
Well, FOMO often stems from headlines and boardroom buzz. Leaders hear about AI diagnosing cancer, predicting hospital admissions, or saving millions of dollars, and they want it. But they jump
That's true.
in without a real plan. That's where the trouble starts. For example, take example of large hospital networks that spent millions on AI-powered triage tools, only to realize later that the data quality was too poor to get meaningful results. That's actually the FOMO in action. Compare that to Persivia, who has taken time to validate tools before scaling, which is much more sustainable. So the pressure is partly competitive and partly it's internal. The teams within companies, they don't want to be seen as laggards with slow performance. The vendors, they pitch fast results. The investors, they expect innovation. But skipping the foundational steps actually leads to disappointment or even worse.
So much for answering that. But do you think that what about the JOMO approach? Which is strategic AI adoption. And do organizations wait for proven ROI results before adopting AI? Or how can JOMO prevent wasted investments and lead to better AI strategies?
Well, JOMO isn't about ignoring AI, it's about being intentional. So the organizations that wait for solid clinical evidence, regularity clarity, and have proven business cases before deploying AI are actually positioning themselves for long-term success. So it avoids the trap of having shiny tech that doesn't deliver. Think of it like if you're buying a car, you don't just go for the fastest one. You look for safety, you look for reliability, the mileage, etc., etc. So the JOMO organizations do the same with AI. They pilot small, they measure outcomes, and then scale only when there is impact. They also involve clinicians early. They ask, will this improve the care? Will it integrate into the workflow? And that patience actually builds trust and avoids burnouts. And by burnouts, I mean both the financial ones and the human ones.
So just to confirm, you are saying that Persivia has taken the JOMO approach.
Yeah.
Okay. So now let's talk about the last one, which is the FOGO, which basically what's stopping some organizations from adopting AI, and why are they so afraid to do so?
FOGO is very real and it's not irrational. AI in healthcare is really complex. First, there is data privacy, the HIPAA Act. Those are serious obligations, and AI often requires large, sensitive data sets. Then comes the integration. Most health systems are already stretched thin with fragmented EHRs, and adding AI that doesn't plug in seamlessly, it actually becomes a recipe for frustration. And then there is regulatory fog. What about liability if an AI makes a mistake? Many leaders feel overwhelmed and unsure where to start. So sometimes it's past trauma. For example, an AI rollout that failed can make the leadership wary of trying again. So it's not that these organizations don't see the value, it's that the road looks too rough to travel on.
That was very well explained, sir. So, what is your final verdict? Do you think that AI is truly a game changer, and should the healthcare leaders slow down? And how can organizations find the right balance between FOMO, JOMO, and FOGO?
Okay, AI can be a game changer, but only if it is treated like a long term partner and not a magic wand. So the leaders need to resist the urge to chase trends blindly, which is FOMO, but also not to be so paralyzed by fear that they miss the real opportunities, which is FOGO. So whereas JOMO, it offers a middle ground, a thoughtful, evidence-driven path. And the key is balance. One has to start with use cases that are high value but low risk, like, for example, clinical documentation or administrative automation. And then you have to measure the outcomes, build the trust, invest in data governance and AI literacy among the teams. And most importantly, you don't need to ask how fast can we do this. Rather, we should be asking how well can we do this, and what does success look like. And in the end, just to cut down the fears, I would say AI won't replace doctors, but doctors who use AI well might replace those who don't use AI. So at Persivia, we started it slow. We weighed the benefits. We saw where would it fit in our workflows, uh, and we tested the grounds before coming into action. We made our clinical team as well as other teams aware of the changes or aware of the impact that AI would make, just to make it more acceptable within the team. And then we started building on that, and that is something which helped us a lot at Persevere.
Great. Thank you so much, Dr. Osama. This was really insightful, and I think that this was great. And
Thank you.
hopefully, we will be doing this again soon.
Sure, sure.